Good afternoon. Can I ask everyone to settle in? Let's settle in and let's quiet down a bit. Good afternoon and welcome everyone for the continuation of our hearing. We had one last week. I apologize for being late. Thank you, Yusek Chua, for being early. You came from the House of Representatives, right? So I was of the impression that we'll start a tiny bit late, and that's why I myself was a little bit late. I'm sorry for that. I'd like to welcome my colleague, Senator Frank Drilon, who was always my partner in the debates we had on syntax, and I'll ask him if he'd like to say a few words. No? Okay. So since it's the continuation, the focus today will be on Package 2 Plus, which is on alcohol. So everyone's welcome to be here, but if for some reason that's not your concern, you're also welcome to leave. That's your choice. And I'll repeat the rules for those who are here for the first time. Since there are only two of us at the moment, then we will interject at any time we want. But in case there will be many more senators coming, then I'll just have to moderate it a little bit more so that we can give as many of our resource person the time. But basically, we'll give Yusek Carl, who has a presentation, the opportunity to present his position, the DOF's position. Reminder, we are practicing a plastic-free or less plastic usage. So this is a different room, but yeah, there it is. The water dispenser is over there, and there are glasses, and we also encourage you to bring your own glasses. Yes. Oh, and aside from Yusek Carl, who has a very animated voice, I encourage everyone not to read their position paper to us because we can read on our own. We prefer that you go through the highlights, you emphasize what's important, and then we take it from there. If you intend to read it to us, then I may tend to also interrupt you because we'd like to maximize the use of our time. So that's all I can remember for now, and let's proceed with Yusek Carl Chua's presentation on behalf of DOF. Thank you.
Thank you very much, Madam Chair. Good afternoon to everyone, to Senator Drilon. We have a joint presentation, Madam Chair. Both Yusek Eric and I will share one PowerPoint. I will focus on the economic aspects, and then Yusek Eric will focus on the health aspect. But before that, Senator Drilon requested me to first explain the present system so that people understand, and then after that, we will go to the PowerPoint to explain the justification, why we need to address the present system's deficiency. If I may start with that. I will just make it brief. Presently, there are basically three types of alcohol taxes. The first one is for fermented products. Fermented products are typically beer. And we practically today have only one rate. And that rate is 25 peso per liter of beer. And we have a very small share that is taxed at 35 peso per liter, but that is only for the microbreweries, which is less than 1% of the beer market. So in fermented po, we tax the whole volume regardless of the alcohol content. And this is a significant improvement because prior to the sin tax law of 2013, we had 4 different rates at different prices and depending on who is the seller. So we have simplified it already, again, to one rate that is 25 peso per liter for fermented product. The second type of alcohol tax is for distilled spirits. These are the whiskey, the brandy, the vodka, the gin, the rum. Basically, products that have much higher alcohol content. Usually, it ranges from 10 to 40% or even sometimes more. And because the alcohol content is varied and the price is varied, we have adopted a good practice, which is to have 2 types of taxes. The first is a specific tax, which is 23 peso per proof liter. Basically, the 23 peso per proof liter means we are taxing the alcohol content, not the volume or the amount of liquid. And that is because of the variety of alcohol in those drinks. Sometimes it can be as low as 20 proof and as high as 80 proof, or sometimes even more. And then, apart from the specific tax on proof liter, we have an ad valorem tax, which is 20% in addition. The reason for this is we also have a variety of prices, from the local ones, which are generally cheaper, to the imported ones that can be 10,000 peso per bottle. So we have adopted that. And this is a significant improvement because prior to the 2013 sin tax law, we had 4 different rates depending on the raw materials, the price, and which led to a WTO violation. That is why we corrected it. And finally, for wine, which is less than 1% of total revenue today, we have 2 different types of taxes. One for sparkling, typically we know them as champagnes, and another one for still wine. For the sparkling, we have 2 sub-rates, one for those below 500 peso and the other above 500 peso. And for still wine, we have 2 rates, one for those below 14% alcohol and another for above 14% alcohol. So this is the rate and system that we have today, which is a significant improvement from the pre-sin tax reform, which is so complicated. And what we basically propose is to further improve the system and adjust the rates so that we fund universal health care, discourage consumption, and to promote a healthier workforce. With that, Senator Drilon, Madam Chair, if we can proceed now to the justification why we need to do the alcohol excise tax. Yusek Eric will begin the presentation. Thank you.
Madam Chair, with your permission, Yusek Carl and I usually do a tag team. I'm going to present the health benefits of sin tax. Sin tax reform is a health reform, and we need it to improve the health outcomes of the Filipinos. First slide, please. What we want really is to decrease the number of Filipinos imbibing alcohol on a regular level, especially binge drinking, and at the same time reduce the diseases and deaths due to alcohol. And as a corollary to that, when we increase in taxes, we also get funding so that we were able to sustain 100% health coverage. Because when we have UHC rolling out next year, one of the first things that we need to do is to make sure that every Filipino is enrolled in PhilHealth. And of course, we want to increase our outpatient checkups and our packages to improve our preventive and promotive health services. Next slide, please. Now, there are 10 reasons, next slide, why we need to raise alcohol, but primarily it's to decrease the number of drinkers, especially among the young and among the poor, also to improve the health outcomes so that we have less health expenditure, and at the same time to reduce the economic cost of alcohol and raise taxes and revenue for our universal health care. Next slide, please. This is the projected, Madam Chair, that money that we will require for universal health care for the next 5 years. For the 2020, we are asking for 257 billion, but Yusek Carl and the Department of Finance so far have only identified about 195. So we have a gap of about 65 billion, mostly for the enrollment of Filipinos of the indigent population into PhilHealth. And this is the money that we're looking for. For the next 5 years, we have right now a gap of about 426. And next slide, please. With the taxes that have recently been approved, from the House Bill 1026, it will decrease that gap, but we want it a little higher, and hopefully the gap, the remaining red one, will just be a little bit more manageable once we have increased taxes on alcohol. Next slide, please. Currently, we have primary care drugs for 18 kinds of drugs. Ito po yung mga most common illnesses: diabetes, hypertension, hypercholesterolemia, tuberculosis, mga pneumonia in children, but we want to increase this to 120 drugs that we may be able to give at the primary care level, at the primary care centers. We treat the most common 7. We're going to be giving 18 now. Yeah, TB.
You're giving 18 now and you want to raise it to 120.
To 120 essential drugs for primary care in our primary care list. And we want to increase the health conditions from the 7 that we are treating to everything that the primary care physician should be able to deliver once UHC is there. And yung copay po natin ngayon, it's really 90%. No? The Filipino people pay 90% out of pocket ng hospitalization. And we want to contain this such that every member, indirect members, when they get admitted at the ward, yun po tinatawag nating basic accommodation, for the most common illnesses, they will have no out-of-pocket expenses. But for the more costly diseases and for those who go to private wards, we want to have a predictable balance, the out-of-pocket, and we want to decrease that. Next slide, please. Unfortunately, this is if we look at this slide, the first 6 quintiles of the population, from the poorest to the 6th decile, actually they spend more on sugar, alcohol, and tobacco than on healthcare. So this is a very sad reality. No? As the income level goes up, the 7th to the 10th decile, then mas mataas na yung expenditure for healthcare. And this is something that we want to reverse, because if you're spending more on sin products, then you get poorer health outcomes, and then you have very little money left for your healthcare. And we want to discourage this. Next slide, please. We want to reduce our alcohol-related deaths. We have about 30,000 deaths every year. And if we increase the taxes with the levels that the DOF and DOH are proposing, we'll be able to cut that in half, from 30,000 to 15,000 deaths by next year.
Can I interrupt?
Yes, Madam Chair.
Can you just go back to the next slide?
The previous one up.
Yeah. Do you have other data? Because I'm not I don't really find this particular table that enlightening, no? That enlightening. Why? Well, if you're healthy, you should not really be spending on medical expenses. You know what I mean? So the comparison I would prefer to see is how much is being spent on sin products versus healthy products. And so we're talking about consumption in terms of food and drinks. That's what I want to see. Are they spending more? Yung mang-iinom ba dun sa bahay, mas malaki yung gastos niya kaysa dun sa pagkain ng mga anak niya? Right? That's what I want to see. And if you don't have it, I think we should get it. Kasi,
of the total household expenditure.
Kasi,
yes, Madam Chair.
Diba, you know naman, when we talk about medical or health expenses, we're going in the direction sana of preventive health care. So when you say medical spending, I'll hazard a doubt, we're not talking about preventive health care. So it barely means anything to me that you have this kind of comparison. Okay?
Yes, Madam Chair. We'll get it as a percentage of total household expenditure.
Yes,
Yeah.
I think that's more relevant,
Yes.
diba? And then depending on what their health needs are they able to cope with their health needs? It's a little bit different eh. Okay, thank you.
Yes, ma'am. So the next slide. Number 13. Yeah, so we want to decrease. We know that once we increase taxes, it's really the most effective way of decreasing the number of people who do binge drinking and who do regular alcohol drinking. And at the level that our models show, that at the level that the DOF and DOH are proposing, we will be able to decrease the number of 30,000 deaths per year to about 15,000 deaths per year. Next slide, please. Worldwide, alcohol is really the cause of...
Just to go back
Yes,
to
sir.
that, 15,000 deaths. What is the total number of fatalities attributed to alcohol?
It's about 30,000 per year, sir.
30,000
Yes, ma'am.
per year. What about cigarettes?
A lot more, Mr. Chair. We have, yeah.
How much? How many in cigarettes? You have 30,000 deaths attributable to alcohol, and therefore
Two
we are-
cigarettes, Mr. Chair, it's about 100,000 if you
are
add
you
all of
only 100,000
per year.
per year versus
Directly.
30,000. So shouldn't there be a relation between the number of deaths we're trying to prevent because of cigarette versus the number of deaths that we're trying to prevent because of alcohol? Should there be a relationship? I'm asking a question
Yes.
which I have no
Yeah.
answer.
No, Madam yeah, the difference, Madam Chair, is that, when we have alcohol deaths are usually in the young. No? So they cost more because the number one killer of young men, for example, is alcohol drunk driving.
I'm sorry?
Yes, drunk driving from binge drink after binge drinking.
Yeah, drunk driving.
Yes. So we have more deaths in young people due to alcohol. Yun naman pong smoking, we have more deaths in older people.
Okay. Answer my question. Is there a rationale for making the number, since it is being argued as a death measure, and shouldn't there be a relationship between the deaths that we are trying to prevent because of smoking and the deaths we are trying to prevent because of alcohol? In other words, I want you to rationalize that this is a health measure.
Yes, yes, sir. We are going to show that they do cause a lot of death, and it's going to be more cost effective if we are able to increase taxes and decrease the number of deaths and disabilities and health problems from alcohol.
In other words, shouldn't we increase more taxes on cigarettes?
Yes, Mr. Chair, but we just did,
Huh?
but we just did, and it will be effective on November and January 1, 2020. So we just want to increase alcohol also at the same time.
See, okay. I just wanted to test your propositions.
So we.
Just to continue on that line of thinking, and I know I'm looking forward. You have other slides on healthcare, so I'll let you continue. But just to put that there, I agree with the point that Senator Gilon is trying to raise. It's a question, no? And in addition to death, the better figures that you need to show us are the lives affected, in addition to death. So what about the living dead who have to live with somebody who has a very serious alcohol problem and beats up his wife, his children? And I think we have if not part of your presentation, we have some people from the NGOs or other groups that want to speak on that. So we would like to see that factored in. So then if you compare that to cigarettes, baka naman walang result ng wife beating or children beating yung naninigarilyo. But for every moment that he's smoking in front of them, may second-hand smoke. And there's even third-hand smoke. So that's just what we want to see. You know, compute everything, how this affects the lives. And I'll call them the walking dead. No, they didn't die, but whether they live with a person who's substance abusing through alcohol or through cigarettes, may effect yun sa buhay nila. So let's look at that later on or at some point. Thank you.
And not only that, Madam Chair, I think if you consider the illnesses, diseases caused by cigarette, it is far, far more complicated than and deadly than alcohol. That is why, selling this as a health measure may be a little hard sell for me, because I handled also the previous sin tax debates, and in our internal discussion, we found difficulty rationalizing this as a health measure. Why don't we be upfront and say this is really a a revenue measure, rather than go through the trouble of trying to justify the health aspect when it appears to be pilit as an argument.
So that's your challenge,
Yes.
to convince the good
Yes,
senator
ma'am.
about that.
Yes.
Ako personally, I'll say that my major, I would say it's a social health issue. In addition to actual physical health, which has its share, but his point is in proportion to cigarettes, no? That's the point he's making.
That is why the proportion of the tax on cigarette to the tax on alcohol is what, Undersecretary Chua? What is the proportion? Is it 70-30 today? 70-30. And that is not by accident. It is a conscious ratio, and that has been there. If you look at the history, I think it has always been 70-30, or was it a different ratio before?
Actually, in very early times, it was 50-50. Prior to the sin tax, it was
50, yeah,
60-40.
it was
Now
50.
it's 70-30.
Right.
So
It was 70-30 because indeed, if it was a health measure, just the logic of it, you tax cigarettes at a much higher rate because of the more harmful effects it has on the health on the health of our people.
Yes. Actually, Madam Chair, if we may continue with the rest of the justification, we hope to try to convince the body that there is sizable health costs. Thank you.
Direct health cost and consequences, probably not as high as smoking, but it is an important cause of death and disability. And the societal cost is way higher than tobacco. Can we have the next slide, please? This, of course, are all the illnesses that are connected with alcohol, anything from the top of your head to your toes. You can have disease. Next slide. But this is an important slide, that the one at the top, for every 100 life years that are lost in the Philippines, yung pinakauna po talaga yung actually is dietary, no? It's sugar, fat, and salt intake. That takes away 10 life out of every 100 life years that we lose. Second is smoking, which is about 9 years. Mas malaki po talaga siya. But the third and fourth are high blood and household pollution, which are very difficult to control. But the fifth one is alcohol use. It's 5 years. 5 life years for every 100 years that we lose, compared to 9 life years of of tobacco. It's smaller, but it's also significant. Next slide, please. And when we look at the deaths from tobacco compared to alcohol, yun pong sa alcohol, they die much younger. It's the blue bar. So once you start drinking, people already start dying from alcohol. And it's because of the binge drinking and the driving ng mga accidents. So these are young people, 10 to 25, 25 to 35. And it's one of the leading causes of death for young men. As we get older, lumalaki na po yung death from smoking because it's a more chronic illness that it brings, and of course the cancers that develop later on mag-i-increase din with alcohol as the person gets older. Next slide, please. So again, we have everything from the mouth to the heart to the brain. Once you lose your neurons after binge drinking, you never recover those. No? You lose them permanently. Your gut, your pancreas, even the reproductive organs are affected. Next slide, please. And this is just an example. When we have a patient with liver cancer, after several years of binge drinking, you have to need 1.5 to 3 million to treat one patient with liver cancer, and about 3 million for a liver transplant. No? So it's very, very costly.
Welcome and acknowledge the presence of our back. Can you hear me? Oh, there. Okay. Yeah? Okay. Would you like to make any statement, Mix? No? Okay. Let me just also make a comment now before you go on to the reduce the health care cost of Filipinos. No, in the previous slide, you showed the harmful effects of alcohol on the different parts of the body, and in the previous slide, you showed the correlation to the age. No, but I think what you need to, we can save it for another time. It's not the only hearing we'll have. What I'd like you or any of the NGOs later on present, just raise your hand if this is the presentation you'd like to make, is to emphasize one of the, what I know, I always make a disclaimer, I'm not a health professional, I have no degree in health, but I am a health advocate and try to keep myself up to date. One of the biggest health problems now in the future will be diabetes. And a big cause of that is alcohol consumption. Many people don't realize that alcohol turns into sugar in your body. So maybe we can have a presentation on that, because if diabetes is going to be the #1 killer, then you have to know what causes diabetes, and one of that is alcohol. So maybe you can emphasize that in some, so that you can really, it takes a little bit more effort to really be able to picture like what does alcohol really contribute to in the bigger picture. Thank you.
Yes, Madam Chair. So, next slide, please. So, right now, PhilHealth claims due to alcohol illnesses secondary to alcohol about 68 million per year, which means that the out-of-pocket cost is probably 94 million. No? And these are mostly from the, of course, poorer segments of society where the out-of-pocket expenses are very, very difficult. No? Next slide, please. Alcohol consumption, we have our Dr. Bernie Madrid here from the Child Protection Unit of PGH, is also considered a risk factor for intimate partner violence, sexually transmitted infections, even HIV in the Philippines. No, it's also correlated with smoking, of course, and IV drug abuse. So we know that people who drink are also more likely to get other illnesses, and yung mental health and suicide is also, of course, one of the risk factors is alcohol intake. Next slide, please. Our road accidents, ito po yung report natin in the last 3 years with about 10,000 road accidents, and they are from alcohol. Yung violence naman ang reported ng police, about 3,500, also happen when under intoxication of alcohol. And of course, yung drowning. We've also had deaths and drowning due to after alcohol intake, binge drinking. Next slide, please. And at 5 million, this is a quantification of the cost of one fatal road accident. It's about 5.9 million for every person who dies because of the loss in labor, social cost for the family, medical cost, and then of course the burial cost. So we lose about 19 billion pesos every year, because last year we had 3,000 deaths from alcohol-related traffic incidents. Next slide, please. Yun naman pong natin for women who experience physical violence, talagang mas common if the husband is a drinker, People who drink alcohol are more prone to parang yung abuse, domestic violence is higher in households where their partners drink. Next slide, please. This is what happened. Yung pong tobacco, when we increased yung sin taxes in 2012, from 29% ng adults smoking, we were able to decrease that to 24%. Almost immediately.
Yeah, just to put it on record, I think we invited PCW and to also help us with the figures, because right now you're just mentioning the figures you're presenting is domestic violence, husband and wife, I hope that we also have figures on violence between people who don't live together, like teen dating or young people who are dating. What's the violence there, and which ones are related to alcohol consumption?
Yes, Madam Chair, Dr. Madrid has
Okay.
a report.
And further to that, just for me to put it on record, the incidence of drinking in schools, and how many kids who studies, how many do we have a record of students that are not doing well in school because of alcohol-related abuses, etc.
Next slide, please. Like I was mentioning, in 2012, when we increased the sin taxes on cigarettes and alcohol, yung cigarettes po bumaba yung from 29% to about 24% yung smoking. But yung alcohol had a very minimal, very modest decrease, from 46% it went down to 44. Kaya lang last year, when people are getting to afford alcohol more, mas malaki po kasing pagdami ng pera kaysa yung pagtaas ng prices. Nag-increase na ulit tayo from 45, it's again up to 46.7%. Next slide, please. Also, with binge drinking was at 56% in 2013, went down a little to 55% after the first round of increases, but now it's up again at almost 56%.
Do your figures take into consideration any shift in the kind of drinks?
This one po, all alcoholic drinks. Walang shifting
walang breakdown
from fermented to distilled.
Because I came across international studies that say that there appears to be a difference between the shifting patterns of those who can afford and cannot afford. So those who can afford would not really shift because they don't really care what the prices are. I think if I recall during can you hear me? Can you hear me? Over there in the back? Can you hear me? Hindi, kayo dito. Pero tatanong ko yung nasa likod. Can you hear me? You can naman? Okay. Doesn't sound like it, no? Anyway, that actually sounds better. So I recall during our hearings, as Senator Drilon was mentioning, we had many hearings a couple of years ago. Even with the cigarette, there was these discussions if there would be shifting in cheaper price brands, etc. I think that's also important to know because, we want to know what's the effect of the taxation. If it's just shifting, then you need to look into are the cheapest brands still very accessible to the youth? We need to know those things, and then I'll correlate it later on to the other activities that DOH is doing to prevent to prevent drinking and of course smoking also. Thank you.
Madam Chair, yeah, in relation to that, to what is being presented, can you present to us evidence that an increase in the taxes in alcohol results in the reduction of the intake of alcohol? Is there empirical evidence to prove that point? When we increase the alcohol tax in 2000, how much? When? 2012, whenever that was. I want to find out if indeed there is a correlation. In other words, where there was an increase in the taxes, was there a reduction in consumption? I don't know.
Yes, Mr. Chair, actually, yeah, this slide shows that in 2012, after we increased the sin taxes, yung pong sa sigarilyo, mas mabilis ang pag-drop from 29 to
Sa
25%.
cigarette, I've seen that.
Yes.
I haven't seen anything on alcohol.
In alcohol po, there was a very modest drop from 48% to 44%. But now it's climbing again. The Filipinos can afford it again, no? Because the amount of money in their pockets is growing much faster than the increase in the prices of the alcohol. So nagbaba po ng konti pero ngayon tumataas na uli.
Let me just acknowledge the presence of Senator Bongo.
Madam Chair.
Statement? Feel free.
Mga familiar faces. Good afternoon to everybody.
Of the Committee on Health, kaya familiar kayo sa kanila. Anyway, please proceed, Senator Drilon.
Madam Chair, may I also ask, our sound system really is not doing, not performing very well. But I'd like to ask either the Department of Health or the Department of Finance, through Yusek Carl or through Yusek Domingo, on the correlation as well of, or the increase on the prices of alcohol with your future prediction of it dropping. How much would we still earn if you do that status quo now with the amount of money that you're earning for supposed to be for the PhilHealth and Universal Healthcare program? If you increase the alcohol tax, will decrease consumption as you predicted it will happen. Will we be getting the same, less, or more for the program?
Thank you, Mr. Majority Leader. Yung nakikita po namin is the income of the people are increasing faster than the tax increase. Therefore, in this slide, if we can show the slide again, there is an initial drop of the prevalence. In 2013, yung 48% bumaba to 44.9%. But then, despite that we continue to increase the tax in smaller amounts, the prevalence increased to 46.7. The reason for this is the income is increasing faster. Therefore, in other words po, if we do not increase the tax commensurate to the income, then it will become more affordable. In fact, in the succeeding slides, I will show some more data to show the trend, if it can wait a bit. Thank you.
Yeah. Next slide. And more, something that's more, to think about. Next slide, please. The next one. So ito po tumataas. But in fact, in the richest segment of society, even if they're getting more money, the binge drinkers are going down, no? From 53% to 49% in 2015 and 2018. But it is in the poorest segment of society where the binge drinking is actually going up. And WHO has shown that when we increase taxes on sin products, the ones that are most vulnerable and decrease their intake, tobacco or alcohol, would be the poorest and then the elderly. Sila yung pinaka-sensitive to price changes. Sila yung talaga nagbababa. So it really does help. Next slide, please. Next slide. And of course, we also want to protect our young people. I think this is Madam Chair, Senator Pia Cayetano was showing us these samples of these products that are now becoming more attractive to young children. And they are, next slide, so they are very, very attractive. Next slide, please. They look like juice drinks, and they are more easy to carry than bottles kasi naka-plastic lang mestro. Next slide. And cheaper than beer. So these are the things that we want to keep out of the reach of children. We can have non-tax measures. We already released an FDA advisory just to remind all of our grocery store operators na hindi ito pwedeng ibenta kasama ng juice, only in the restricted part with the alcohol. But they are still a lot cheaper than the other alcohol products out there, and we want to increase their price so that they become out of reach for young people.
I'll just show this to my colleagues. We presented this in the last hearing. These are actually alcoholic beverages that contain 7% alcohol. Tapos may straw pa siyang kasama, and as we pointed out, ay ikaw, tikman mo, sige. Tikman mo. Oo. Teka.
I haven't
Dili.
tasted this. Ngayon ko nakita ito.
Ano ba yan?
Wala ibang color?
That's the
Gusto mo
point,
magpalit
di ba?
ng kulay? Gusto mo magpalit ng kulay?
I-compare nyo ang flavor. No, but that's the whole point because it becomes very interesting to the kids. I mean, what adult would really say that, di ba? Anong color? But the kids would. And it has more alcohol content. It has more alcohol content than beer.
Baliktad, sir, baliktad.
Although yung iba ginaganon din nila, pwede mo rin naman tusukin yan dyan.
You see, I really don't really drink.
Tusok,
I can't
tusok.
even-
O sige, lahat na tayo uminom. Sige, sabay-sabay kaming inom. Mag-take over ka na lang, Yusek, ng hearing. I pointed out, it's actually baliktaran. Baliktaran siya, Migs, look, oh. Baliktaran siya because pag siguro lasing ka na, mababasa mo pa rin, makaka-order ka pa rin. If you turned it around, which you shouldn't because you already opened it, but if it's not yet open, you can just turn it around. So, can you taste the alcohol?
Tamis.
Yeah, that's the thing. I haven't tried it, so I'll do it now.
Bigyan nyo marami si Senator Drilon.
No, more than beer. It has more than beer. Actually, for the record, I'll put it on record. I don't think that a child would know because like if a child tries beer or gin or vodka, automatic yun they'll react eh. But this is so sweet. There's just this parang may pagka-heaviness lang. So that's really what bothers me. And what bothers me more is that unless my staff hasn't updated me, pagkatapos kong manawagan sa mga groceries to ensure that they're not carrying this beside the juices and that they're making sure that it's not easily accessible, wala man lang akong narinig na reaction. So if the industry is going to try to lobby for kindness, it's not gonna easily come because I don't feel that there's much of an effort to ensure that our youth do not have access to drinks like this. That's how I feel about it. Kasi I would imagine that there would be shock, from the highest officials in their companies to find out that it's being marketed this way. But just by the look of the packaging, it appears that si Bongo nga nakyutan eh. What more pa yung mga bata? Nakyutan ka, 'di ba? Naghanap ka pa ng ibang kulay.
Lakas 7% to?
Yeah, 7% nakalagay.
Lakas, no?
Ang lakas.
Yeah.
Mas malakas pa sa beer, no?
So these are some of the stores where it was found. I'm sure there are more, but I think DOH, no, you did this. So should we drink or should we continue?
Yeah. Madam Chair, maybe
Yes.
I can continue while you enjoy your drink.
Okay, it's not for the record. It's not meant to be enjoyed. This is ano ba tawag dito? Parang kumbaga sa ocular inspection. What's the right term for this? Product knowledge. Test study daw. Okay, please proceed.
Thank you, Madam Chair. Let me continue at this point to present the three remaining economic justification before I go to the proposed reform. The eighth reason why we propose to increase the alcohol excise tax is basically to discourage consumption. And what we have seen across the products, whether fermented, distilled wine, or alcopop, which is an example is the gas that you are consuming now, is that even as we raise the taxes since the 2013 sin tax reform, we continue to see higher consumption. The reason po is simple. The tax increase is lower than the income increase. So over time, people can afford. That is why we are proposing higher increase. And Madam Chair, you requested data to see what is the trend comparing the three different types of alcohol, yung fermented, yung distilled, and the wine. Basically, as of 2018, 71.6% of revenues are coming from fermented, basically the beer. 27% are coming from the distilled, and 1.4% coming from wine. And you can notice yung distilled ay lumiliit, yung wine lumalaki. So this is the trend that we are seeing. In terms of the consumption, this is data from the global data, a source that collects data from alcohol industries around the world. And Philippines overall on a per capita basis is consuming much more than the Asia Pacific average and the global average at 11 liters of ethanol per year compared to Asia Pacific, which is 9.3, and the global, which is 8%. Part of this is we are a fast-growing economy where income is increasing. The other reason is we have been much lower at increasing the alcohol excise relative to other products and to the income growth. To compare the affordability, the Philippines product for beer are among the cheaper ones in the Asia Pacific region. So here we presented three products comparing to the most sold brand in the rest of the region in US dollar terms, and you can see that the three products are relatively cheap compared to the rest of the region. In the next page, we also compare a sample distilled product, the Gordon's London Dry Gin, which is also relatively priced cheaper in the Philippines. So all of these suggests that there is room to increase the excise tax on alcohol. Now, when we put all together the reasons stated from number 1 to number 9, what we found based on the study by REM 2009 across the world on the cost of the alcohol, it is estimated to be 211 billion to the Philippine economy by 2020. And this is a combination of deaths, sickness, loss of productive time working, the caretaker, the grief, the beating, and so on. The details we can provide the committee. And finally, to address the Senator Drilon's concern, we also want to rebalance yung sharing of tobacco and alcohol, which is now 30-70 in favor of tobacco to the somewhere closer to 42 and 58 once we do the reform, so that the burden doesn't fall only on one product, which prior to the sin tax, we already see a more balanced sharing. Given the top 10 reasons, we now propose the alcohol excise tax reform. Basically for distilled, let me summarize first the main before I show the rates. For distilled, we propose to maintain the structure of having both ad valorem and specific. So one to tax the price differential and the other to tax the alcohol content. And then for the ad valorem, we propose increasing that from 20 to 25%. For the unitary specific, I will show the schedule in the following slide. And then after that, a 10% automatic indexation, which basically follows the growth of income of the country. For fermented, which is basically the beer, we propose to maintain the specific tax per liter, but we increase the unitary specific tax, which I will show the rates later. And then we also have an indexation to 10% after the specific tax increase. Again, I'll show it later. Then let's remove now the distinction between those sold in breweries and those sold direct to the consumers. And finally, we tax alcopops like the gas that you have just tasted, like beer, because they are being marketed as substitutes for beer, easily accessible. And finally, for wine, we maintain the structure for sparkling and for still and fortified. but we increase the rates, basically mga 10%, so that we adjust the rates to income so that we can catch up. So these are the details. The blue ones are basically what the DOF and DOH are proposing, and the red one is what the House approved on second reading last week. So for fermented, typically the beer, we are proposing to increase the 25 and 35 per liter to 40 starting next year, followed by a 5 peso increase until we reach 55. After that, we will apply the 10% automatic indexation. Compare that to the House, which passed a much lower rate, which begins at 32 peso per liter next year, and only 2 peso adjustment every year thereafter. Now for alcopops, we are basically proposing that they be taxed like beer. Alcopop is like the gas that you drank, Senator Drilon. It is basically like a soda pop, but contains alcohol. That is basically the term that is used. It is like, well, pop is like a soda pop, soft drinks. But instead of just sugar, meron pa siyang alcohol. So these are the gas product that you tasted. If I may proceed to the next one, on distilled, what we propose is to keep the structure but increase the rate from 23 to 40 per proof liter. So it doesn't mean that the entire product is taxed at 40. It depends on the alcohol content. The more alcohol, the higher the tax. The less alcohol, the lower the tax. Notice that the House already approved a gradual increase, but it started at 35, not 40. And then the next slide is the ad valorem. We propose to increase from 20 to 25%, but the House approved a lower rate, which is 22%. This is to tax the price differential. I will not belabor on the wine, but it is basically a 10% increase. Let me now show you the revenue impact of what the DOF and DOH proposed and what the House approved on second reading last week. In 2020, we proposed 33.3 billion. However, the House approved a much lower package, which will only get us to 16.6 billion. And the remaining years will show the growing gap and therefore lower funding for the universal health care. Again, according to the universal health care, we are proposing to get the 15.5 billion from the recently approved tobacco law, 36.5 billion, hopefully from the DOF and DOH proposal that the Senate might want to consider, therefore giving us a much smaller gap, which is the red of 10.4 billion, which I think is more manageable, so that we finance universal health care according to what the law proposed. Senator, Madam Chair, you requested some cross-country comparison. So without going to the very detailed, let me show you some illustration. The first one is which country tax fermented products with a unitary rate and which country tax fermented products or beer with multiple rates. And you can see overwhelming the region is taxing unitary. So this is a good practice. Let's not have different rates because different rates will create the downward shifting to cheaper products. So we should preserve the beer as is. Okay. If the minority leader is okay, I will proceed. Next, on distilled spirits. Majority of the countries in the region tax distilled as unitary, but there are 1, 2, 3, 4 countries in the region out of 10 that taxes distilled as multi-tiered. Multi-tiered is what we had seen prior to the sin tax reform. So we propose that we keep the single unitary for Philippines because majority of countries are taxing distilled as unitary, not multi-tiered. Otherwise, we will have downward shifting again, and it is not really good. Then we go to wine. Again, for wine, a slight majority of countries are taxing them unitary. The Philippines is among those countries that have multi-tiered, because we have one rate for sparkling, one rate for this for still, and within the sparkling we have two rates depending on price, and within the wine two rate depending on alcohol. But I suggest not to touch this because wine is only 1% of the market, but we can consider, but the impact will be much less. Next slide. Now on the fermented, there is a question whether we should retain the specific tax on a volume basis, yung liter, or shift to proof liter, which is based on alcohol content, or ad valorem. What I propose is to follow the wisdom of the 15th Congress that agreed that a specific tax on fermented is easier because we just count the volume. Anyway, most of the beer are in the 4 to 6% alcohol content. So hindi naman magva-vary ang beer. So let's just keep the present system and increase the rate. Next.
The present system is both specific and ad valorem.
For fermented,
For
only
fermented.
specific.
Wow.
Only specific for fermented. So we propose to keep it. But to answer the minority leader's question, for distilled, it is a mix.
Yeah.
So the
For
next
distilled,
slide.
it's a mix, yeah.
So we are in the yellow. I propose to keep it because the wide variety of alcohol and price warrant having a dual rate. One that will address the price variation, the ad valorem, and another to address the alcohol variation. Kasi yung proof can be from 20 to 80, and I have seen even more. So let us keep that, and because the 2013 sin tax already addressed those problems, so we just have to adjust the rates. And finally, for wine, you can see we also have a mix, but I suggest we keep it because wine has a very small contribution, too much effort to adjust it. But if there's appetite, we're open to adjusting so we can simplify the system. Now, the next question that the committee may want to know is what is the impact on price? We have many examples, but let me just show three. Let us begin with the most popular beer, Red Horse. It's a 1 liter bottle. Of course, you do not drink everything. You share it with your friends. So from 86.90 SRP, the House approved an increase, which is 93 pesos. And the DOF-DOH proposal is 102 peso. So you can see that the increase is not significant. You are just sharing the additional 17 peso with your friends. And if your income is increasing with the lower income tax and the fast-growing economy, we believe this is affordable. Another example is the Alcopop, the gas that you just drank. Hopefully not too drunk. From 25, it is going to be either 30 according to the House or 32 according to the DOF-DOH proposal. So again, I think if this is to address the problem that the youth will consume these products because they look like Zesto, then the higher price warrant to dissuade them from consuming. Of course, we will also remove them from the shelves.
And I will also ask DOH to work with FDA on packaging requirements within 30 days. If not, I will file a bill on plain packaging, just like the tobacco.
Yeah.
Because I cannot accept, because my son will walk through that aisle and grab that drink.
Yeah. Madam Chair, I'm also ICO FDA.
No,
So,
I know you are.
and
that's
when
why
we-
that's why malakas ang loob ko to say within 30
Yeah.
days. Because
And-
I'm already drafting that plain packaging bill because I'm so annoyed that this is available in the market in those kind of cute colors.
Yes, madam. And
That
we also
forever I will remember na pati si Bongo na cutean.
and we found out that the product registrations are actually expiring soon, and they will be applying for renewal. And I want that that packaging regulation in place
Kindly
before.
talk to the team
before
because
that.
I don't know how they allowed it. I mean, now we all know that marketing is all about visuals, and they allow this kind of cute packaging. Yeah, it should be packaged the same way like a regular gin is packaged. Clear packaging, red, black. So I'll either require plain packaging or two colors, that's it, and definitely not pastels.
If I may continue, Madam Chair, the example here is the Emperador Light, 93 pesos to 99 or 102 peso. Again, this is not meant to be drunk by one person, this is shared. So the prices you see are affordable, and that is why we think it will not address the problems. Oh, sorry.
Actually, what my my lawyer and I did late into the night is, she said you provided, no, but sometimes it's easy to remember when you do it yourself. We computed per shot,
shot,
per shot
yes.
and per serving. Because if I compare the tax that you're imposing on a 320 ml of beer, that's normally one drink, compared to the 350 ml of gin bilog, the cheapest one, lumalabas na yung tax implication per shot, and I divided it into 10 shots at 35 ml, no? So, roughly one shot is so small. I think if my computation is right, it's about, because the total was 46 pesos, wala pang VAT. So it's like 4 pesos. I mean, that's not a huge price to pay compared to the whole beer, which is, so the whole thing was 46 versus 32, subject to your confirmation, assuming this is fairly accurate. But that 46 pesos for the gin bilog is divided by 10 servings. So I want you to be able to present that so that it becomes, people understand how much is this that we're imposing. It's not a lot. Thank you.
Apo, we can submit to the committee the per shot or per serving basis. Now, mm-mm.
Make assumptions.
Yeah po, serving size, ma'am. If I may conclude the presentation by responding to the top 10 concerns of stakeholders.
Charles, Madam Chair, may I just request, do you have data on, for example, Tanduay Rum and San Miguel Pale? Kasi yan ang iniinom ng masa.
Yes, we have data.
Is it there
We
on
can
the
show
price
it.
difference?
Apo, maybe we can ask the PowerPoint hidden slides to be shown. This is pale from 34 to 36 according to the House, and
Okay.
39 according to the proposal of the DOH and DOF. So I think you will notice that there is a 5 peso increase, but this is, I think, manageable because of the income growth and the tax rebate that we have given.
Yung malaki, medyo malaki masyado yan, 5 pesos per bottle. So if they drink 3 bottles on an average, it's 15 pesos.
Yes.
For a laborer, that might be earning about 500 pesos a day.
Well, we hope they will cut
Stop
down the
drinking?
drinking.
Let's hope so too. But yung Tanduay, meron kang ano dyan sa
Tanduay,
Tanduay?
yes, we have a Tanduay hidden. There po. Ano? Yeah, Tanduay ice. We can submit po the Tanduay rum.
Because rum is the second largest consumption in the Philippines.
Yes.
I believe it's more the brandy that's stipulated here. That's the mga Fundador, Emperador.
Okay.
I presume the second largest it's just rum.
Apo,
It's probably Tanduay. So we'd
Tanduay,
like to see
yes.
the difference on the bottles.
Okay. If I may, Madam Chair, conclude my presentation with the top 10 concerns and how we address them. So we propose to just end with this because the stakeholders will raise these concerns. So we are advancing our comments. So the first one is that the current system is not fair. Basically having 3 different types of system for fermented, distilled, and wine. Our response to this is, I think the 15th Congress, when they enacted the sin tax, in its wisdom, already corrected a lot of the problems in the past, and we should just keep the system and address the affordability by increasing the rates gradually. The second concern is that a multi-tier rate is more equitable. Again, the 15th Congress already ruled or legislated that it is not a good idea because of downward shifting. So we propose to keep the present system. The third concern is the higher excise will increase smuggling. This is not an excuse not to do the reform. What the answer, I think, should be is we will do both the reform and the anti-smuggling effort, which BIR and BOC can explain later. The fourth concern is higher excise will lead to job losses in the industry and increase inflation. We do not see this data after the 2013 sin tax. Yes, in the initial year, there was a slight reduction, but it recovered very quickly. And we see the people continue to consume as evident by the higher prevalence of consumption. Number 5 concern is it will hurt the industry and the economy and increase inflation. Well, we do not see that. We see the profits and sales of the companies increasing, and the inflationary impact is only 12 percentage point. So in other words, if the inflation is expected to be 3%, if we do this reform, the additional will be only 0.12 or 3.12, so hardly any increase in inflation. The sixth concern is that it is regressive, but for a bad product with harmful health effect, we want it to be regressive so that the poor will reduce the consumption of these products. Now, Yusek Eric will continue the health justification.
For the health concerns, Madam Chair, the concern really is that alcohol taxes have a heavier burden on the poor. However, the WHO studies have shown that actually the cost of healthcare caused by alcohol is higher in the poor segment, and we're actually saving them more from health expenditure and giving better outcomes to the poor, and they benefit more than any other segment of society. The eighth concern is that increase in alcohol tax will just make people shift to drugs. Meron din po kami nakuha na ganito na concern, no? When actually alcohol, smoking, and drugs are correlated, no? People who drink are more likely to go to smoke and more likely to go into drugs. And that has been shown that when you have lower incidence or prevalence of alcohol, you also have lower prevalence of smoking and alcohol and drug intake in the community. Next slide, please.
Let me just acknowledge the presence of Senator Sherwin Gatchalian. Would you like to make any statement or just, yeah? So, but feel free anytime.
Yes, sir. Madam Chair, and of course, the one concern is that drinking alcohol is a coping mechanism and part of our culture, and a recreational activity which we should not deprive anybody. But our proposal is really not to prohibit it, just to discourage the binge drinking and the harmful excessive intake of alcohol. It's also to discourage the young from taking up the habit and getting addicted to alcohol. Next slide, please. The last concern is that increasing taxes will not change the behavior of current drinkers. But it has been shown that it does not change the behavior of people who can actually afford it even at a higher price. But for people who are very poor and the elderly, they're actually very sensitive to price change. And when we increase the prices, the young and the poor and the elderly are the ones who actually decrease their intake. So it is a win-win solution for everybody. Next slide, please. And to summarize our presentation, next slide, please. We really just want to ensure financial sustainability for our health expenditure programs. The taxation is going to help us fund universal health care, particularly enrollment of all segments of society into our insurance system. Next slide, please. We want to discourage excessive alcohol consumption, and this will lead to better health outcomes, especially for the young and for the poor. Next slide, please. We want to save lives. We think we can save 15,000 lives if we get taxes at the level of the DOH and DOF proposing every year, and about 57 lives in the next 5 years, 57,000 lives. And lastly, we want to ensure a healthy workforce needed to support our transition to a high-income country. Higher taxes means less alcohol intake and better health outcomes for the population. Thank you.
Mings, please go
Thank you,
ahead.
Madam Chair. Madam Chair, we do support the program of the Department of Health together with Department of Finance on their increase in income on tobacco and alcohol tax. However, we'd like to go towards the end game, which is really to help the PhilHealth program, our universal healthcare program. But I guess I'll address this to Yusek Carl and Yusek Domingo. This is very important because I've gotten many cases wherein the PhilHealth is actually, the PhilHealth component on a bill of a patient is so low. Yesterday, I got a call from a media friend of mine from Bacolod who asked me for help because her bill was, yung anak niya na dengue, at ang bill niya umabot sa 53,000 pesos. As a matter of fact, I have the bill. This is in a public hospital in Bacolod. And yet, the PhilHealth component is only 7,800 pesos. So, tax tayo ng tax dito ng mga products, alcohol and tobacco. You're here every year. And we're coming up with different taxes to fund the universal healthcare program. And yet, the PhilHealth only comprises not even 1/5 of the bill. Diba? Siguro may mga tao dito na naka-experience yan, mga pulis, mga kapatid natin, kawani sa gobyerno, na ganun po, napakalit, not even 1/5 of the bill. Akala ko nag-implement na tayo ng no balance billing. At may assurance ba tayo na pag tinaas natin ang buwis nitong alcohol and tobacco, we just passed the tobacco, so now it's alcohol, will it translate to larger, I would say, subsidies in your next billing pag magpagamot po kayo? Kasi right now, I'll be honest, it is not being felt. Senator Drilon, who just left, I was just going to point him as example number 1. He just had the heart procedure to make him stronger and to make him feel younger. 7,000 din po ang minus sa kanya. Or less than 10,000, he told me. Kasi he showed me, sabi niya, Mix, parang useless ito. Kasi ang laki ng bill ko. Pero ito lang nabayaran ng PhilHealth. Ano ba talaga? Nakikinig ang taong bayan sa atin. I think it's very important that they know na it's not all food coloring or packaging on the universal health care. Kasi we thought that there'll be no more balance billing, probably in government hospitals, but in this situation, it was a government hospital, and she still had a balance of over 40 plus thousand, over 53,000 peso bill. May I get a comment from the DOH, particularly?
Yes, sir, Mr. Majority Floor Leader and Madam Chair. It will, exactly why we need them more money, first of all, so that everybody will be enrolled and premiums for everybody will be paid. And the pool will be bigger, and of course, yung lalaki po yung premiums.
Member na siya ng PhilHealth eh.
Yes, yes,
So,
sir.
anong
But
ibig sabihin nun?
ito po kasi pati yung mga hindi pa member ngayon, mababayaran din yung premium nila, so lalaki yung ating pool of money. With UHC po kasi, by the time we roll it out next year, 90% of all beds of public hospitals are mandated to become what we call a basic accommodation. Yun pong simpleng kama, no? Halimbawa, 3 o 4 na pasyente sa isang kwarto, walang aircon. Kaya lang po dun sa mga basic accommodations natin, all patients who come in with regular illnesses like dengue, pneumonia, infections, yun po mga simple lang, appendicitis, are supposed to have no balance billing. So talaga pong 90% ng beds ng government hospitals and 10% of beds of private hospitals will be no balance billing beds. Ito po yung basic accommodations. Hindi po siguro for the catastrophic illness, no, kamukha ng cancer or bypass, hindi naman po natin kaya yun. But our regular run-of-the-mill illnesses like dengue and pneumonia and appendectomies and deliveries
Actually,
will
what you
become no
should-
balance
If I may
billing.
interject, what you need to do is give us an update. Every senator should have one. Because if hindi kami updated, pag may lumapit at nagtanong bakit kami nasingil, at least even our staff can read that, kasi covered yan dun sa no balance, di ba? Kasi without knowing, wala kaming info na mabigay. Ako, my staff knows kasi we update ourselves as to what is the latest diseases or ailments that are covered, no? But I don't think the average person would know. So I would suggest that lahat ng congressman at lahat ng senador, bigyan nyo ng list and then your targets. And then also, as to the total funding that will be available to PhilHealth, why don't you give us a pie chart that shows how much goes to the premium, how much goes to infrastructure and rehabilitation and construction of new hospitals? Kasi it's hard to understand where it goes, knowing that it's in the billions, and then thinking na all it takes is 1 or 2 patients to come to us and say, di kami natulungan. And yung impact sa amin is malaki. And ang conclusion a lot of times is, saan napunta yung pondo?
Sure. If I may, maliit lang talagang ang impact na lumalabas na yun. That's why I'd like to ask, I guess, the PhilHealth, does everybody have a basic premium? I mean, Juan de la Cruz or Senator Cayetano or Senator Gatchalian, do we have the same with our PhilHealth cards? When we go to hospital, yung minaminus lang sa bill is only the same amount? 7 to 10,000? Parang ganun lumalabas eh. Hindi lumalampas na 15,000. I've yet to see PhilHealth pay for over 15,000 pesos worth in their bill. Eh alam naman natin kung private, yung 15,000, isang oras lang yata yun sa Makati Med or sa St. Luke's. Eh kung kailangan ng specialized treatment, talagang mapupunta yung pasyente dyan. Kung sa public hospital naman, ganun din ang lumalabas dahil sa gamot, dahil sa mga facilities. So, maybe, meron ba tayong premium na natatanggap na yon? What do you say, premium or coverage? You correct me if I'm wrong, no? Coverage, how much coverage are we given now as compared to the passage of the universal healthcare that we passed by Senator J.V. Ejercito last year for after the implementing rules and regulations are published? Tataas ba? Magdo-double ba yung coverage? And then, instead from 15,000, akyat ba ng 30,000 yan? Kasi kung hindi, all our discussions here will be for naught. Because sinong kikita lang yan? I mean, we're going to get about how much billions are we planning to earn from this, Carl? How many billion pesos are we planning to earn from this alcohol
Our
tax?
proposal is 33 billion.
Yung sa tobacco last year.
For the tobacco,
the
is
last
the one
Congress.
that was recently approved is around 15.5 billion.
So you're looking at
45,
45,
47.
47,
Yes.
that amount?
Yes.
Almost 50, depending on
Almost
the
50, yes.
consumption next year. So you're looking at almost 50 billion additional income supposed to be for PhilHealth. But that's my question now. Is the funds actually being utilized where it's supposed to be, which is to reach the public, yung ating hirap na hirap sa buhay na hindi makabayad sa kanilang billing? So ma'am, can you guide us? Kasi alam mo, araw-araw ma'am, if you come with me today, after this, I'll hold your hand, I'll take you up to my office. Ang daming nakapila dyan ma'am. Sa 5th floor, puno ng tao yan, hindi po politiko yan. Mayan po ay tao nang humihingi ng tulong sa amin. At palagi namin tinitignan ang billing kasi hindi naman namin pwede bigyan kahit sinong pumunta dun sa amin. At dun sa billing, napapansin ko talaga yung PhilHealth coverage. It's only between 7,000 to 10,000. Pinakamataas na yung 14,000 na nakita ko na covered ng PhilHealth. Kaya ang katanungan ko po ay, ano ba ang talagang standard rate na coverage ninyo? At nung inapprove na po namin yung batas, ano na magiging panibagong rate kung meron man? At dito po, sa dagdag na buwis na ipapataw natin sa ating mga kababayan, meron ba additional bonus in terms of coverage, additional coverage ang ating mga kababayan? Kasi kung hindi, parang walang impact. You know, if we use it all on infrastructure, it will only go to a few provinces that will have particular coverage, but not everybody concerned, no? From Metro Manila, Mindanao, and Luzon and Visayas. So, Ma'am Nerissa, what could you say about that, Madam Chair?
Yes, Madam Chair and your honorable senators. Currently po, before the UHC Act becomes effective after the IRR has been passed, there's no balance billing only for the indigents and OFWs in the government hospitals and ward accommodation. Upon passage of the Universal UHC Act, this will change since everybody will be entitled to no balance billing if they occupy basic or ward accommodation. And this will control the balance billing for these members who will go to this accommodation levels. For the non-basic ward accommodation, because of the additional funding, there will be more money for PhilHealth to negotiate with the providers and be able to contract with them the level of fees and thus impose fixed co-payment. The fixed co-payment will be the out-of-pocket expenses that the patient will pay on top of PhilHealth. And hanggang dito na lang po yung dapat nilang bayaran. And the hospital should not charge beyond this PhilHealth benefit and the out-of-pocket or the fixed co-payment that we will impose to the hospital for the services that they have rendered. So yun po yung pinaka benefit that they will get, and it will improve the support value of PhilHealth upon the passage of the UHC Act.
May I just make a quick reaction to that, no, to clarify, because I'm very much involved in, to the extent that I hear the different cases that we hear of, no, because they go to our offices. One of the biggest problems that I've experienced is that they don't want to go to the ward. They would go to an up level, because the facilities supposedly in whatever public hospital near them, they don't find it, they're not comfortable with it. So that's one problem we have. And that's what can be addressed by improving the facilities, obviously, right? Because in other countries, I was recently in London and I visited a friend who was in the ward, and it looked like very nice private hospital. So that's one thing that we need to address, because Filipinos will always want to care for their sick loved one, and then when they look at the ward, they'll put them there. So that's the biggest problem I've always encountered, na humihingi ng tulong pero doon nila pinasok sa private, either private hospital or the paying section of the public hospital. So that's one. And then the second thing that I wanted you to be able to present to us, whether quickly now or in the future, is yun nga, ano yung mga klaseng sakit? Kasi nga, you mentioned appendectomy, and I know that's covered. Diba? No balance billing yun. Pero ang dami din kasing lumalapit sa amin, cancer. So the truth is, hindi natin nako-cover yun. Meron yatang a few. In fact, one of the problems I encountered before is, I think something like, we're going to pay for 2 or 3 cycles, right? May ganun ba? May ganun ako narinig before, 2 or 3 chemo cycles. But they need 7 or 10. So then, mga ngapa sila, how to get the ano. So those are the problems, no? And maybe you can list this down, talagang checklist, so that we also are aware, para ma-explain din namin sa tao. And it justifies us asking for more funding from the public, from different sectors, and for my colleagues to be excited about having this hearing. Otherwise, parang ang feeling nga is, anong natutulong namin?
Thank you, ma'am, for the question. Well, for one, for the non-basic ward accommodation, that's the way what I have mentioned earlier.